It's only us right now?
I'm letting people in
Okay.
because realizing that me scheduling this Zoom from my account is probably the worst thing I can possibly do.
Well, yeah, you have the bootleg account, remember?
Yes. Yes. Bailey has the bootleg
And
account.
I don't even think you have the ability to let other people co-host, do you?
I don't.
Which maybe that's the issue. For the doctor, do they want to share something?
Actually, let me test something because I think I do actually have the ability.
You have it, you just try to set it.
Yeah.
Before the students get on, one of the students, Imani texted me talking about I didn't get paid this week. I completed all my assignments. If it's because I didn't go to class, I understand, but I really needed that money. And I texted her back. I said, I'm sorry to hear that, but you only get partial credit.
Right. And she answered her thing right there.
Answer her own question, because I've had this conversation with her. I've tried to get her to come in class. And she feels like she doesn't need it because she's ready for the test because she already did this last cohort. Okay, it's up to you, but you're forfeiting your stipend.
Right. Andrea Bland, is that the woman? Oh God.
Yes.
Yes.
Should we let the doctors in first?
Dr. Andrea. Yeah.
I don't know. Okay. I don't know the wrong person doing this.
I met her in a phone call yesterday, so I can say hello.
Oh, Ashley. Oh, I let Ashley in. Okay.
Prosperity.
Wait,
so
Ashley.
Have some type of prosperity or success, especially if you're like someone that deals with food. If you do deal with food or you're a chef or something like that.
Ashley.
Oh, that's our Ashley. Okay. Oh, yeah. Wrong person. I'm such the wrong person for this. Oh man.
Oh, if you need help, make somebody co-host.
That's the thing. It's not allowing me to co-host stuff.
Can you make me the host?
I make anybody a host. It's like hot potato. I'm just passing it to somebody right now. Can I? Oh man, this is. Don't drop the ball, Q. All right, you know
the
what?
Settings, Q.
You okay?
I'm good. I just.
His Zoom is different than everyone else's.
Because
Takesha's the host now.
Letting people in with I always have
with reckless abandonment. Reckless abandonment.
So hold on. Who are we letting in?
The staff.
Okay.
Andrea Bland. You can let her in. She's a doctor.
Okay. So.
Oh God.
Michaela Porter. That's a student, right?
Student.
Yeah, Michaela. She's culinary.
What is the Andrea Bland? Okay.
I can greet her too because I was on a phone call with her yesterday. So there we
go. Randy, I'm still trying to see if this.
Hey, doctor. Hi, Andrea.
Hi, how are you?
I'm Jared here. We were on a call together yesterday. Finally get to see your face now.
I'm like, I know, I remember.
Awesome. Good to see you and thanks for being here.
Yeah, absolutely.
We've got some you're seeing some of our other staff here.
Hello.
Yes. I'm trying.
Joe, Cynthia, Takesha, Quinton, Angie.
Hi.
We'll be letting students in.
Yeah, I'm trying to get the staff first.
Great.
Am I missing someone? Alex Welch.
Ashley's getting a sneak peek.
Yeah, I was too early with it.
That's all right, Ashley.
Is that all for staff?
Mm-hmm.
I don't see.
So I think Alex, Courtney are on a tour of Hop Red with Greg. So
all right, I'm trying to. I don't see them. So you guys let me know when you want me to let in the participants.
Sure.
Hi, Andrea. How are you?
Good. Hi, Kayla.
Hi, everyone.
So, can you let me know if the doctor is they might be in the waiting room?
What is the doctor's name?
Dr. Hetty Cunningham, Steve Chang,
yes.
and Megan Job.
Okay.
Thanks, Andrea.
No
I was
problem.
forgetting who was doctor and who wasn't.
Right.
So, right, Dr. Cunningham is the doctor. Steve Chang is the nurse practitioner, and Megan job is I know she's a student, Dr. Cunningham, but is she a biology? Oh, there she is. Hi, Megan. I believe she's a biology student, but I guess she could let you guys know once we get started.
I don't see Steve Chang in the break.
Okay.
Yeah.
Okay.
Yeah, I wasn't sure if Steve could make it today. I'm not sure. Hopefully.
Yeah, I didn't hear anything back saying that he wouldn't make it, so we'll see.
Okay. So I guess maybe about another minute or so, and then we can start letting the students in. Pretty much this is all the staff that'll be here. How's everyone's day going so far?
Pretty good, yeah.
March is the funniest one. It's rainy and cold, but you know, last week we had 60s. Go. All right, Takesha, I guess it's 1:05, so we could go for it. Do you also want to assign one of us as a co-host so that we can see?
I cannot have that ability.
Okay, my
And I'll just switch it out to whoever needs it.
As you guys log on, go ahead and just mute yourself. Go ahead and just mute yourself as you log on, guys. Thanks.
I don't have mute.
Do you
So
want me
it
to-
says you're the host, Takesha.
Right, but this is Mr. Bailey's and it doesn't allow you to do.
Okay,
call.
so can you make Mr. Bailey the host?
Sure.
And then Mr. Bailey, can you co-host someone?
Okay.
I don't know if it does that. but-
If, yeah, his won't let
Make
you
sure-
do that.
Make sure to mute yourself, guys, if you're just coming in the room. Thank you.
Host.
Oh, his won't let you do it.
Right.
Okay. Do you have the abilities to mute all, Mr. Bailey?
Mute. Oh. Emit. And mute all. Yes, everybody has been muted. Everybody.
So not for right now, just in case, like I know the students are gonna come in and just want to make sure that as more people start to join, we're able to.
People are saying hi in the chat. Hi, everybody.
All right, so just let us know when you'd like us to start.
So for all our participants and alumni, I put a sign-in sheet into the chat. So please sign in, okay? Please sign in. Thank you.
Do we have more waiting? No,
Nobody's in the waiting room.
I'm gonna give it to 1:10 and then we can start because I definitely want to leave some time for question and answers.
Once again, to our participants and alumni, sign in. The sign-in sheet is in the chat. We're starting momentarily. Okay, great. So I have 19 people signed in. Thank you, guys.
Okay, Mr. Bailey, do we have anyone else waiting?
No.
No. Okay. So I think it's fair to start. If someone else comes in, Mr. Bailey will look to the waiting room to let them in, but definitely want to be mindful of everyone's time and appreciate you guys for coming to speak with our students today. So I will pass it over to you.
Thank you so much. Thank you so much, Ms. Simpson, Mr. Bailey, Ms. Bland. We're thrilled to be here. I'm Dr. Cunningham, Hetty Cunningham. I'm a pediatrician. I work and live in Harlem. And I've been here for 25 years in the same practice. And I'm up at, I'm affiliated with New York Presbyterian Hospital. My family is from my grandma was born in Panama. My great grandmother was born in Jamaica. They came through to work on the Panama Canal. And but since then, my mother was born at Harlem Hospital, and we've been New Yorkers. So that's my story. With me today, I believe Stephen Chang, maybe, I can't tell, but I think he may not have come today. But let me know, Stephen, if you're here. I have with me Megan Job, who is a pre-medical student and a scientist. And Megan, maybe I'll just let you introduce yourself.
Yeah, hi everybody. My name is Megan. I'm 21. I'm from Brooklyn. I go to school up in Middlebury, Vermont, a very, very small school called Middlebury College. And I'm a pre-med student. I major in neuroscience, and I'm an associate scientist in at the New York Genome Center in affiliation with Columbia downtown in Manhattan. So.
All right, so we'll have an opportunity to talk more. We're going to start actually with questions. So we're here to think about the COVID vaccine, theoretically. And so just going to take a few minutes, and people can put questions in the chat. Oh, I see we have a question. We have a hand raised already. So you can raise your hand, put questions in chat. I guess that would be the best way. And we will just go through that. And I think that will make sure that we really target what we're talking about to what you're interested in hearing about. Megan will be able to join us, I believe, until 1:45. Is that right? Okay, she has a previous commitment. So, all right. So we'll start. I want to start with Kareem, I guess.
Hi, I have my mask on. Can you hear me?
A little bit, yeah.
Okay. So my question is, I'm kind of like nervous about taking the vaccine because I was born with a blood condition that affects my blood, and it comes with other problems such as kidney problems and stuff like that. So I just wanted to get your perspective on taking the vaccine, especially with people that have medical conditions.
Okay. Great. So that's obviously a really important consideration. I think in general, it would be good. You could consult with your doctor as well. But in general, people with medical conditions are considered to be those who should be getting, the vaccine sooner, that kind of bumped up on the line. There are certain blood conditions, so I'm not exactly sure which one, but there are certain conditions where your white blood cells aren't able to make a response to a vaccine. So in those cases, those people might not, it might not help them to get the vaccine. It wouldn't harm them, but it might not actually help them because they can't make the immunity. in general, there's, when there are people, there's some blood conditions where people bleed more easily, like hemophilia. For those folks, we who are giving the vaccine, we ask, if somebody has that condition, then we hold the spot for longer to make sure there's no bleeding, as we would do with any vaccine. But in general, the vaccine is indicated for blood conditions, and in fact, people who have cancer, people who have, I'm not saying that you do, but that is a blood condition as well, are higher on the list and considered to be people who should be more so even forward in the line to get the vaccine. Did I answer your question, James?
Yes, he did.
Oh, Kareem, sorry, I'm getting confused because now James is the one with the hand up. Sorry, go ahead.
You did. You had mentioned the white blood cells, and that's part of my problem. But I think if I produce too much white blood cells, so just like a short summary, like my body eats the platelets instead of, because of my body eating platelets, I produce like a lot of white blood cells. So that's kind of where like my issue comes in at, because I do bleed easily. I bleed more than a normal person. Like sometimes a small cut would bleed for hours. So that's just like my main concern.
So it does seem like then, but I would encourage you to consult with your doctor, but it does seem like, you would be able to get the vaccine and should get the vaccine. And then it would be good to tell them that though, so that they would hold the area for longer, put pressure. Okay, thank you for asking, getting us started with the questions. That's an excellent question.
Dr. Cunningham, I'm gonna keep my eye on the hand raising because I know it could be a little overwhelming. So we do have a few people, and as long as you guys keep raising your hands, I am making note of it. So I'll just, so you're not looking over the screen. I'll just call them out as I see them. Dion, you had your hand raised? Okay.
Yeah, I have a question. My question is like, how do you just come up with a vaccine, right? And then how vaccines, like for example, pneumonia, they have like the long-term effect. So in the sense of they did studies like what happened to you in 4 years or what happened to you in 5 years. So like with this thing, what will happen in 4 or 5 years? You know what I'm saying? Like it makes them saying it's safe, but they don't actually have data, which will lead in like for the future. So I'm trying to my thing is, what is the long and short-term effect of this?
Mm-hmm. Megan, is that something you want to take on? Is that a question?
I could take on it a little bit. A lot of people have said that to me because I was one of the first people to jump to get the vaccine, and my family was not a fan of that. But what Dr. Cunningham said in our previous conversation was, we've been studying vaccines for a very long time, right? So this vaccine is newer, right? mRNA, the technology is like 20 years old. So that's new in the science field, but we've been studying vaccines for the past 100 years. So we know how vaccine administration plays out for the most part, right? So that's where I have my faith in it, right? So we won't know just yet, but I have faith that it will be just fine, just because of all the previous vaccines that we've been administered, that we've had as children, our parents have had, our parents' parents have had.
I understand that, but also you got cases where a lot of people are dying from it also. So how can you feel safe if people are dying from a vaccine they made and they have no explanation on what's going on? You understand what I'm saying? So.
That's an excellent question. And the reason why I turned to Megan is because she has recently, she's more so in the vaccine science because she studied vaccine development. I think each person has to make their own decision. It is true that a few people have died after getting the vaccine, but people do pass away in general. And now 110 million Americans have gotten the vaccine over the course of the past number of months. And the overwhelming majority have been fine, and the safety, the scientists and the people who are watching this, for side effects and for difficulties, and it has, there haven't been any significant ones. On the other hand, we know how devastating COVID is. And we're finding out more and more, even for people who've had an asymptomatic COVID, we're finding out more about long-term effects on the heart, on the blood system, on the brain. So everybody has to make their own decision. But I think what's important to note is that I think people think that we tend to think that if we don't do something, that we're not causing an effect. You know what I mean? It's like we go on, we put something in our arm, that's an active decision to do that. However, I think, and that's kind of like human psychology, but the thing is that deciding not to do something is also an active decision. And so we don't really think about it that way, but it might be good to think about it that way. But thank you, Dion, for that excellent question.
Thank you, Doctor. Thank you, student. We also have James, but there's a question in the chat that's stating, what's the survival rate? What's the death rate for COVID-19 vaccine getters? If you can address that, and then James has his hand up.
What's the death rate for people getting the vaccine?
Mm-hmm.
It's very small, but I'm not sure of the actual death rate. Megan, do you know?
No, I actually just looked it up. I'm on the CDC website right now, so I can get back to you guys in like
okay,
5 minutes. Let me scan.
Okay, good. Thank you.
Thank you, Megan. Okay, James.
He wrote it in the chat. He wrote it in the chat.
You wrote in the chat? Okay.
He says, is it safe for children and teenagers to take the vaccine? That's James's question.
It's a fantastic question. So the vaccine has been studied in teenagers, and it's now approved for 16 and up. And we started to vaccinate 16 and up at the medical center. We're starting with teenagers who have serious illnesses. So they're kind of first in line. And it's being studied in children. There's ongoing studies in children. And I can't remember, I just heard recently when they thought that was going to be approved, when those studies are going to be completed. But they're not completed yet. So sometime probably in the early summer is when potentially younger children, and they're now studying from 6 months to 11 years. So that's kind of like the newest group. And this is the group of people who get COVID the least severely. So that's why they're kind of last on the list. Yeah. Mm-hmm.
Okay, and we have Christian, and then I'll address the question in chat. So Christian or Orozco, if you may. Unmute. Okay, he gave us the pause.
Quentin, I could answer the question. I just read from the cdc.gov website. It said that from December, so the person who asked about the survival rate for the vaccine, Dr. Cunningham was right. There is no statistics specifically available, but it says that they administered around 13 million vaccines, and there were 113 deaths reported, but there was no relationship between the COVID-19 vaccination and the death. Okay, so I can give you guys the statistic 113 out of the 13 million, but it says that there was no relationship between the COVID-19 vaccination and death. Okay.
Thank you, Megan. Christian, is your audio working now?
Is it working?
Yes,
hello?
Excellent, sir. Yes.
Okay, cool. I just want to say thank you everyone for coming and answering these questions. Very much appreciated. My question today is, I personally actually got the vaccine a week ago. It was the Moderna one. And from my knowledge, isn't it that white blood cells record the data from getting a vaccine to get, immunity to that virus, right? So what is the point of the second dose of Moderna if your white blood cells are already recording the information it needs to defend yourself?
Such a good question. Megan, do you want to answer that, or I can?
Yeah, I can answer and then you can answer as well, Dr. Cunningham. But I think that that's a really good question. And actually the second dose is the same dose as before, right? They're just giving it to you a second time just so that you can have a stronger immunity for it, right? So the first time you're introduced to it, you're right, your white blood cells do kick in, they recognize what's going on and they start to create the antibodies, which is what you need in order to fight off the actual virus whenever you come into contact with it, if you come into contact with it. And then the second dose is just literally making your white blood cells even more efficient at recognizing what's going on. So, yeah.
So would you technically have immunity on the first one technically, or would it be stronger technically on the second one? Like you would still have immunity, but not as strong as the second one, right?
So your first vaccine, I'm not too sure of the exact percentage, but it's around, I think like it's different for Pfizer, Moderna, Johnson & Johnson, but you have somewhat immunity, right? It's not the full 94, 95 you hear at the end of the second shot, but you do have somewhat immunity, like 60, 70. I could be wrong. Dr. Cunningham, I think knows.
Yes, no. Originally, they were reporting for the Pfizer that after the first dose, you would have 3 weeks later, you would have 54% immunity. And then after the second dose, 3 weeks after that, you would get up to the 94%. But now they're saying that even after the first dose of the Pfizer, you're getting up to a 70-something%, even after that first dose. It's called boosting. And so, when you're a baby, you get, I don't know if you guys don't remember, but we all did. We got our shots at 2 months, 4 months, 6 months. Then you get the same shot again at 1.5 years, and you get the same set of shots again at 4 years. So this is it's called a boosting effect. So yes, you have some white blood cells that are activated the first time, and then you boost that. Similarly, like with your tetanus shot, right? You get it. So with the tetanus shot, it has more to do with it. What the immunity wanes over time, but it's basically a boosting effect, and there's more complicated science to it. But yeah, they learn. But once they learned once, they learn better the second time, essentially. Yeah. But with the Johnson & Johnson, that technology is just the one time. So it just depends on the technology, and that's a little bit above my level of expertise, but the vaccine scientists understand it.
Okay, thank you, doctor. And participants, there are a lot of questions coming in the stream. Everybody will be addressed. I am seeing a lot of messages. I do want to address also the ones who have their hands raised. So please be patient for those who are sending me exclamation points in private messaging. We are going to get to everybody's questions here. Thank you for your patience. And yes, please keep the questions coming. Ray, you had your hand raised, and then we'll go back to the chat. Ray?
So
wrote in the chat.
Okay.
He
said, what are the exact side effects of the vaccine?
Okay, thank you, Ray.
The side effects of the vaccine are basically the same as the side effects of any vaccine. The soreness at the site, fever. You can get, most people just get soreness of the site, if anything, but some people can get fever. They can feel tired, body aches. And some people, it does knock them out for 1 or 2 days, like they are tired. In my experience, the people who have more so side effects are those people who also had COVID and then they got the vaccine. And they're just a little more tired for a couple of days. So what I got in terms of side effects was soreness at the site. Megan?
I didn't get much. I got my second shot actually yesterday. No, 2 days ago. And it was just, my arm just hurt. That was it. And my mom, she's older. She had no arm soreness, nothing. She had absolutely nothing.
Yeah, my mom had a fair amount of arm soreness, but nothing else. She's 88 or something. Those are the main side effects. They ask you when you go if you have allergies to any of the contents that the vaccine is made of, things that are in the vaccine. And if you do have allergies to that, then they're not going to give you the vaccine at that time. You maybe can get it in an allergist office. So people with severe reactions to the ingredients in the vaccine, that's a contraindication, but it's pretty rare because they're not common things that people will be allergic to. Probably you never heard of them, like polyethylene glycol, and they're not things that people mostly have allergies to.
Thank you, doctor. And I'm going to get to you in a moment, JC and Mr. Wellington. I do want to address some of the questions in the chat. Can you take the vaccine while you have COVID?
Basically, no, because you're supposed to stay home when you have COVID. So they're not going to want you to come in. And they ask you if you have any symptoms or if you have had COVID recently, you're not supposed to come in. It mostly has to do with, well, I mean, if you have COVID, you should get better and then think about vaccination afterwards. But yeah.
Okay, thank you so much for that. One more before we go to the hands being raised. Toddlers cannot get vaccinated, and I think that's maybe the toddlers and the young children. We have a few moms in the room, and I think they want to know that answer as well.
I believe toddlers will be able to get the vaccine in the summer, but the studies haven't been done in children yet, so we're waiting.
Thank you, thank you. Mr. JC, would you like to ask a question to the doctor, please?
My question is, I'm actually type 1 diabetic, and I have been for 17 years. So I just want to know, like, if I was to get the vaccine, like, how would my body react to it, like in any sort of way or anything? Because I've also I am a father too. My daughter actually, when she was sick during that time of like November, December, before it was clarified as COVID, when she went to the doctor, she was sick for a couple of days. When I went to her pediatrician, actually called me like probably like 3-4 months after that, he did a blood test on her and she did come out with the antibodies for COVID, but I was around her majority of the time and I wasn't, like contacted with it either. So I just wanted to know, like, how would that do? Like, let's say if I was to get the vaccine.
That's an excellent question. I mean, you would be on the higher priority to get the vaccine. People with diabetes are high priority to get the vaccine. And the diabetes wouldn't have anything to do with your reaction to the vaccine. And it would be highly recommended that you get the vaccine as soon as you can. Yeah, diabetes is a risk factor for COVID infection. So it would be good to get that.
Okay. All right. Thank you so much. I appreciate it.
Thank you, JC. Excellent question. My apologies. Now, okay, sorry. Sorry, bear with me just 1 second. All these questions are coming.
Mr. Bailey, did we get Wellington?
We're going to get to him in 1 second. I'm trying to get a healthy balance between the questions in chat as well as the questions, the hands raised. But yes, Wellington, go ahead.
I just wanted to ask. Okay, so I have a brother he basically has sickle cell disease. So let's say, for example, if he does take the shots, what would the effects be on him? Like, how would he feel and stuff?
I think Dr. Cunningham might have froze you guys.
Oh, she did freeze. She froze. Okay. Dr. Cunningham, are you with us? Yes.
Yes, I'm sorry. If that happens again, Megan, just go ahead. I apologize. Can you repeat the question? I know you, yeah, if you could repeat the question, that'd be great.
Oh, I was saying, okay, so I have my little brother is diagnosed with sickle cell disease. So I just wanted to know, let's say, for example, he does take the shots. What would be the effects towards him? I don't know if you ever had any patients with sickle cell disease that got the shots and they overreacted or stuff. I just wanted to know what would be the effects towards them.
We do have patients who have sickle cell disease, and they are highly recommended to get the vaccine. They get all the vaccines. In fact, they get extra vaccines because of some of the risks that they have to a number of additional diseases that they're more susceptible to. So he would be able to react to that vaccine exactly the same way as he reacts to all the vaccines. And it's particularly important for him to get the vaccine as soon as possible.
Thank you. Thank you, doctor. To keep the flow of the questions going, how do we know for sure this vaccine can help cure COVID? Oh, she froze. Oh,
Yeah. There are studies that show that the effective rate is just out of the roof, right? So before they administered the vaccine, there were people that joined studies who were tested on essentially, and they were administered the vaccine and they didn't contract the COVID-19 virus, right? And, in comparison to the control group or the people that had a placebo, they just had saline injected to their arm, there were higher rates of COVID-19. So that's how they knew that, Moderna, Pfizer, AstraZeneca, Johnson & Johnson, that it wasn't not effective because people who had the vaccine weren't able to contract COVID, or if they did, or if they didn't, it was at a much lower level than the people who didn't have the vaccine.
Megan, I'm going to ask a quick question. If you can go a little bit more into that process about the placebo and the regular injection, so for our participants, we understand.
Definitely. Yeah. So Pfizer and Moderna started making their vaccine last year when COVID hit last year in December of 2019, right? And then I would want to say January and February, they started producing their vaccine. I was an intern at Pfizer last summer, actually, and I had a friend who was in the study. And what they did was they created their vaccine. First, there's 3 trials in order to create the vaccine. It starts in animals, mostly in mice, and then they move up to humans as it goes along, right? And they have this, they have a control group, which is somebody or people who get a placebo, right? And they compare the placebo to people who have the actual vaccine, right? So let's say I get the actual vaccine that in my arm, I got Pfizer, but my friend got saline. She's in the placebo group. So they're going to watch both of us. They're going to send us out into the world, have a regular life, and they're going to see, oh, okay, my friend came down with COVID-19 and she had the placebo, but I didn't. But they're going to do this on a bigger scale. I'm talking 30,000 people in comparison, right? And you'll have 15,000 you'll split it down the middle. You'll have 15,000 that get the placebo. They don't know. And you have people who actually get the vaccine. And what they saw was in the people who actually had the vaccine, there were crazy low rates of people without COVID. I'm talking out of 15,000, Pfizer had maybe 11 that came down with COVID-19, but it was asymptomatic versus the placebo group that had, higher rates, 64%. So that's how they know. And what's really good about this is that, it's available to the public. So if you look up Pfizer's study, if you look up Moderna, Johnson & Johnson, all the different vaccines that are available, they have their studies out and you can read it and, make your own decision yourself.
Thank you. Thank you for making that clear. We're going to catch a couple of hand raises and we'll go back to the chat. So participants, there are a lot of questions, at least 20 questions in the pool. So I am noting every single question that is in the chat. We will get to that. Keep them coming. You guys are doing awesome. And thank you again, to Dr. Hetty, Dr. Cunningham and Megan. Destiny, would you like to present your question, please?
Yeah. My question is, she said that the people who take the vaccine, they didn't come out with COVID. So what about for those who haven't taken the vaccine and yet to catch COVID? You get what I'm saying? What if the vaccine is, because there's I don't know, I've read stories about people not having COVID going to take the vaccine and now they got COVID. You know what I'm saying? So it's kind of hard to, it's hard to believe that the vaccine is curing people when certain people never had it. And then when they went to go get the vaccine, they ended up catching it. You see what I'm saying?
Yeah. So what about the COVID-19 vaccine, right? It's protecting you for when you come into contact. I think it's important to realize that, it's not a shield per se. It's not like the virus can't come inside of you. The virus still has the option to come inside of you. It's whether or not, if you'll be able to fight it strong enough. There's a period of time when you get infected with something where your body has to recognize it and then build up immunity towards it, right? And in that time, a lot of people go through the mishaps of COVID. They get hospitalized, they're aching, it's sores and whatnot. So the vaccine gives you the ability to gain that immunity, that 2-week period where, COVID's inside of you and your body's freaking out, being like, what is this? I need some armor right now. You get the armor before you even come in contact with the virus, right? Through the vaccine. So I think it's important to realize that it can still come into contact with you, but it's whether or not if you have the armor, if you have, the stuff in order to fight it off really quickly. And that's what the vaccine gives you. It makes you stronger. you get the vaccine and you get these antibodies, and the antibodies are like, we know exactly what COVID-19 looks like. So if it decides to come up in here, we'll be able to bust it down really quickly, right? So you'll have the vaccine and you'll be good. But when you come into contact with COVID, he'll still come inside of you, but you'll be able to recognize him so quick. And instead of, trying to break him down in 2 weeks, you'll break him down in a day or two. You know what I'm saying? So there are cases where people do come down with COVID-19 after the vaccine, but they are not hospitalized per se, which I think is something that we really need to applaud, like all the scientists that, created this, because they're not hospitalized. A lot of them are asymptomatic. And that's exactly what we want. We want it to be something that's not, makes the whole world stop, Everybody gets a cold, but not everybody gets sent to the hospital. And COVID-19 is, there's either you'll get a cold, you'll get nothing, or you can be hospitalized. And we've seen so many people be hospitalized, and we don't want that, right?
Excellent. Thank you, Megan.
I actually have to go, you guys. I have class, but it was so nice talking to you. Bye.
Thank you,
Megan. We appreciate it.
Thanks, Megan. It was great. Thank you.
Okay. So
thank you.
we're going to keep the flow going. Again, we're at least 25 questions in the hole, so we are going to get to everybody. So please be patient, because like I said, I'm getting a lot of private messages with exclamation points and awesome emojis. But everybody's question will be addressed. Okay, so we're going to go to Kay with the hand raised, and then we're going to go right back to the messages. So Kay, would you like to give us a question, please? Okay. Okay. So Kay, you want to unmute yourself? Okay, keep it going.
So wait, Kate actually wrote in the group.
Oh, she wrote in the
I
chat.
just want to remind you guys, please make sure you're listening, because some of the questions that are coming in the chat have been answered already. But I'm going to do Kay. Kay had a couple of questions, so starting from Kay. Okay, if the diagnosis requires you to stay home and that's the cure for getting better, what necessary? Okay, all right, Kay, you're gonna have to get back to us, because I think your message got a little bit broken up, so we're not sure what you're trying to ask. So when you get a chance, come back to us. Mr. Bailey?
Yes, okay.
I
So
think you were calling.
Gianni?
Yeah, so I just wanted to ask a question. I guess it would be more so as far as action items. So for those who, for example, are in more underserved communities, communities where there are not a lot of health centers, and so they have an initial bias towards vaccine and towards kind of their own agency within their health, how would you expect to kind of be promoting this vaccine in a way where they will actually take it, especially since there's bias with syphilis treatment, et cetera, just constant kind of seeking health as a person of color? How would you kind of advocate getting the vaccine for these communities that have this bias?
That's a great question. I mean, I think that's what we're trying to do here. And that's why, Megan and I are volunteering our time, because we have very many family members who fall into that group. I would just say it's not just communities of color, right? I mean, the very white communities of the Upper East Side of Manhattan has a whole vaccine hesitancy group there. There's a lot of people, you hear about in the Midwest on the Republican side that don't believe in the vaccine. They don't believe in COVID. There's a lot of actually right-wing websites that are specifically created to disseminate false information about COVID and COVID vaccine. And those websites get so many more hits than actual reputable websites like the CDC. And so people are consuming a tremendous amount of false, frankly, absolutely not true at all. And that's in all communities. So these algorithms, this fake news kind of situation is also feeding a lot of what's happening. I think the other thing is that there's not, people don't have access two vaccines in our community. And so I know, many people of color who want the vaccine and can't get it. It's very difficult. They're working, they can't refresh, and they can't, like, it's very hard to find a vaccine. So I think that those two things are linked. When when the people who want the vaccine get it, and then they tell their friends and they're like, yeah, I'm fine. You're kind of, you're entering into the community. If it's not available, nobody got it, then it's much easier for there to be this idea that people don't want. I mean, many of my patients in Harlem, they want the vaccine. They have difficulty getting it. Otherwise, I think it's just about talking about it, and that's why hopefully, this group here will have some knowledge to pass on, and so that the folks that you're talking to don't have to be reliant on false information and rumor.
Right, and that's definitely more relating to my question, I guess, when regarding the communities of color, those who are more willing to listen, I feel, versus the right wing, who are obviously kind of combining it with political beliefs. But the underserved communities that are more willing to listen, they're just skeptical because of previous experience with the medical system and people of color. So then my concern would just be, how would we be kind of offering this health literacy to them, right? Because health literacy in itself is kind of what is bridging that gap. So my concern was, what would it be beyond word of mouth? Just because I have a friend, for example, he lives in a neighborhood where there's one health center within about a mile, and it's a very small clinic. He has maybe one grocery store, there's liquor stores and a lot of fast food places. And so areas like that where people just aren't, they don't really have that health literacy, or they don't have many options, right, to know about their health. So I want to know, will that be offered? And also, will it be kind of advocating for more vaccine use versus just offering it to the elderly and those who are immunosuppressed?
I mean, Biden is saying that the vaccine will be widely available by May, and it does look like that. I mean, every time I turn on the radio, it's like another, last week it was 100 million, and this week it's 110 million. So the country is getting vaccinated. I think, I can send this group, one of the doctors in our organization put together like a hip hop COVID, video, which is very cool. There's a number of things like that, other things like that on the internet. I'll send that. So, and then I think, if I think of other, but it's a really good question.
So Quentin, I want to help you because I'm looking at time, and I'm going to just read some of the questions in the chat because I know you're trying to also get the hands raised. Ramel said, will we be required to take another shot every time a new version mutates? So we've been hearing about these new strands. Just want to know to answer Ramel's question.
That's an excellent question. With the flu vaccine, we do take a new, the flu mutates every year, and sometimes it mutates a little bit and sometimes it mutates a lot, right? We saw, you guys, I'm not sure how many years ago that was, but you may not have been aware of, like H1N1 was a big shift in the flu vaccine. And so everybody had to kind of, really get vaccinated for that, because it was in a way similar to COVID-19. Our bodies didn't have any experience with it. And it was a devastating flu year. Spanish flu would have been a similar type of shift when you have a dramatic shift. So COVID-19 may be around, and it may be shifting, and we may have to get boosters, and I don't think anybody knows, but definitely. And I mean, that's another reason to get the community vaccinated quickly, because the longer the vaccine has a population to mutate, it will mutate. It will variants will occur in order to evade the vaccine. And so that's, the longer it's sitting out there, the more time it has to mutate.
Thank you. So John Ortega, just to answer your question, it says, will we need to take a COVID vaccine every year like the flu? Based on Dr. Cunningham's explanation, it appears so that we will need to take it once a year. Destiny had said something earlier about children and autistic kids. As Dr. Cunningham stated earlier, we have not received the statistics regarding that yet. Right now it's being tested in children. So you look out maybe, I guess, early spring, early summer to find information regarding children. Trying to see, did I miss anything?
Yes.
Destiny said this, and I think this is a good question. Earlier, she said, why 3 shots? Why 2 shots? Why 1 shot? So I think that's been a question that a lot of people have. So Dr. Cunningham, if you could respond to that.
It has to do with how the vaccine is constructed. And I kind of wish Megan was here because she knows more about the details of the vaccine science. But it has to do with how the vaccine is constructed. The Moderna and the Pfizer vaccine are constructed one way, and the Johnson & Johnson is constructed another way. So yeah, that's all I can
I'm
say.
gonna do the last question, and then I'm gonna jump it back over to Mr. Bailey. Amanda had said earlier, what would you tell them, a person who expressed concern over long-term effects of COVID vaccine, especially for the Mirena vaccines that are considered newer? Women also concerned with infertility risks, patient issues, sterilization. So what, to answer that question, infertility or men taking it, sterilization, what would we say to those patients?
That would have been a good one for Megan, because I know her whole family was like, thinking about this sterilization. She's 21, obviously. But obviously it's a big issue. There's zero science behind that rumor that is circulating. It's not a thing. Sterility related to the COVID, that's another thing that was probably put out by one of these right-wing websites. There's no basis, in fact, at all. So that's all I can say. There is no sterility related to the COVID vaccine.
Okay, thank you. No problem. Brashay? Brashay?
Hi,
okay, hey, good morning. Good afternoon, Brashay.
Hi, how you doing? The question I asked, hold on, I had to go back to it because I sent it to Mr. Bailey. Hold on. Oh, the question I asked, I said, how many doses of COVID-19 will a person need to get?
So it depends. The Johnson & Johnson is 1 dose, and the Moderna and the Pfizer are 2 doses, separated by 3 weeks. So you get 1, and then 3 weeks you go back and get the other one. In terms of the AstraZeneca and the other, I'm not actually sure yet, because it's not.
Okay. I'm sorry to interrupt, but I heard tomorrow will the Johnson & Johnson be distributing the vaccine to younger preteens? Is that correct? 13, 14, 16? 15?
Starting tomorrow?
Yeah, I believe so, but I'm not sure. That's why I'm asking. Is it true?
Does anybody? I wasn't aware of that. As far as I know, we're just doing the 16 and up now, but I may have missed that news flash.
I could probably answer just because I've been in several of these workshops. I'm gonna go along with what Dr. Cunningham said. It's been approved for 16 and higher. It's still saying that they're working on statistics and testing for children younger than 16. So I know Johnson & Johnson is available and more people are going to start receiving it, but I have not seen anything that it's going to be available in children as soon as tomorrow.
Thank you so much.
No problem.
That's a great question. Thank you.
Quick question. This was in the chat. Since the vaccine has to be stored at such a cold temperature, what temperature will it be given when it would be what temperature will it be when it's given? I guess
It's given at room temperature.
Okay.
So it's thawed and given at room temperature.
Okay.
I have a question.
I don't know who that is.
My name is Jada.
Okay, there you go.
Good morning, Jada. You just logged in. Good morning. How are you? Good
Good
afternoon.
morning. Good morning.
Okay. Answer your question real quick, and we can go back to the line that we have.
Okay, so my question is the vaccine beneficial?
I mean, I'm here to say that I think it's highly beneficial. We have 500,000 people who've died from COVID. My community has been especially severely affected. And the only way to come out of this is by vaccination. Either people have to get the disease, and many of, a good number of them will have long-term effects, if not more severe effects. And the only way to stop this pandemic and the loss of life and illness is by vaccination.
Okay.
Dr. Cunningham, I think this is another great one. Can someone take one year and switch to another the next? Does it matter? So if you take Moderna this year and Johnson and Johnson next year?
That's an excellent question. I don't know, but I'm going to say no, because with the flu vaccine, there's so many different kinds, and you get a different one every year. It's not a problem. So I'm going to say no, but that's a guess. And I haven't seen it written anywhere. I'm always hesitant to pass on purely my opinion, but I would say probably it's fine either way. So it's a good question though.
Thank you. Can we address Destiny? She's
Go ahead.
Destiny.
Did we address Destiny? Because I know I answered a few in the
Yeah,
chat.
I got I got a lot of
Okay.
questions.
Yes.
I don't know if this question was already answered because I came into the meeting kind of late, but why is there multiple vaccines? Like why are there multiple companies issuing out one vaccine? Like my question is when COVID first came out, whatever the case may be, it took about like 3-4 months for a vaccine to even come about. So why did it take so long for a vaccine to come out? And now damn near every major science company, is issuing out one now. You know what I'm saying? Like now people have choices, and before there was none. Like, is there
an excellent question? I mean, it has to do with vaccine science, and I mean, vaccine scientists around the world have been racing to develop a vaccine ever since this came onto the scene, right? So all around the world, companies have been racing to develop a vaccine. So the ones that we're seeing now are simply the first ones that have gone through all the steps and have made it to market. There's some international variation. There's some vaccines that we don't have that are being given in other places. That's basically the reason. And the other thing is that when you have a company with a certain way that they make the vaccine, they can only make a certain number. So, because it takes materials to make, and, they're using all the materials and the people that they have. So that's basically the story. A lot of different organizations now creating as many vaccines as possible, and then they have to go through the different checks and balances. The checks and balances here in America are different than the checks and balances in other countries as well. So that's why there's, some vaccines might be given more in other countries.
Thank you. I found another one in the chat that I thought was really helpful. Dion had mentioned it earlier. And what are the contradictions regarding, or what are the correlations, I should say, more regarding prescribed medications and the COVID-19 vaccine? So is there anything a person who has to take prescribed medication, should they be aware of, or is there anything to worry about?
There is, in terms of what we call immunosuppressants. So those are medications that decrease your immune system. There are certain people who have diseases that their immune system is very active, overactive, you might say, and that causes disease in and of itself. So they get injections or they take medications to decrease that. People with cancer. I was just talking to a friend who, has been getting cancer treatment, his white blood cells are low. So if he gets his vaccine right now, he's not going to be able to mount a response to that. So he might as well wait until his cells are ready to make the response. So it really has to do with more so the effect of the medication on your ability to mount a response to the vaccine, and for the vaccine to do what it needs to do in you. So in those cases, you know, we had a question about that actually, where I was giving vaccines the other day. We said, you know, talk to your doctor. Someone was going to get an injection. He thought, you know, we looked it up and said, you know, you may want to delay that other injection while your body has a chance to mount the immunity for the vaccine. So, but it's something, if someone's on a medication, they should really be speaking to their doctor.
So Mr. Bailey, I think we have one hand raised, and then I think it's 2:00 now. So want to be mindful of everyone's other obligations now that it's 2. So Mr. Bailey, you want to call, is that the only hand you have left too, Christian?
Yes, that's the only hand I see. Thank you.
One hand and one in the chat.
Yes, and yes. Okay, Christian, can you present your question to us, sir? Thank you.
Hi again. I just wanted to ask, this is just a one-off thing that came off of my head. If you get a blood transfusion, is that possible is it possible to get the vaccine from that? Like actually from someone who got the vaccine with a blood transfusion?
And that's a great question. So I mean, you know, blood transfusion is one thing. Some people get actually white blood cell transfusions or antibody transfusions, because I have actually patients of mine who don't make antibodies. They can't. So it's like an HIV type illness. And so they get infusions. So they don't get vaccines because they're getting their antibodies from an infusion because their body doesn't make antibodies. The thing is that right now, so they could get antibody infusions of COVID vaccine, and we're working on getting that for them, but that's relatively new, right? There's not that many people yet who have those. So in general, a blood transfusion is not going to give you enough antibodies, and blood cells are actually washed. So they're not giving you enough antibodies, but antibody transfusion is another thing. And if a body can't mount a response to a vaccine, then you can get antibody infusions, but that's a kind of a technical issue. Yeah.
Thank you.
And I know we're very, very pressed for time, and I apologize. I just want to make sure everybody gets validated with their questions. 2 more and then we're done. How did the vaccine come about so suddenly, and what are the exceptions? Who must not get the vaccine?
So I can show, and you know, have this PowerPoint that I usually don't show because I think people's questions are much better. But I can just show you how the vaccine was developed. In terms of who shouldn't get the vaccine, it's people who've had severe allergies to things that are in the vaccine. So if someone has had what we call an anaphylactic reaction to medication, then they're going to be asking you more questions about that. That's basically like when you've gotten a medication and you have difficulty breathing afterwards. If just in terms of looking, these are COVID-19, why to get the vaccine, but there's a slide on here that I think shows how do they make the vaccine so quickly. So we spoke about this a little bit. The vaccine is based on decades of research for similar vaccines. The timelines were overlapped to speed up the process. However, all the same safety standards and expert review were used as in all vaccines, and I'll just show you here. So research, there's phase 1, phase 2, and phase 3 trials. Whenever you're developing anything, any medication, vaccines, no different. So usually these testing phases, phase 1 lasts 1 to 2 years. Then you're allowed to go on to phase 2. Phase 1 is it safe? Not does it do anything, but is it safe? Phase 2 starts to say, okay, is it safe and does it do something good? And then phase 3 is, okay, now we know it's safe. Now, is it really have the efficacy, the effectiveness that we want? Then it goes to the Federal Drug Administration and the Centers for Disease Control. They review it for 1 to 2 years, and then finally it goes to production. In this case, none of the steps were left out, but they were overlapped. So as they were testing the safety, then they were testing also safety and efficacy. And they were testing how effective it was. So they were overlapped, and that's how it was done so quickly. So this was done quickly. And then in terms of the review, they paid a lot of, extra reviewers to speed up this process of FDA and CDC review so that the production was sped up. So this expert review was 1 to 2 months, and finally coming into production. So that's, I just want to, it's a little bit easier to look at it, but.
So the time is now 2:05. Thank you, Dr. Cunningham. Thank you, Megan. I know she's no longer here. Thank you, Andrea. Thank you to you and your team for joining us today and coming and speaking with our students as well as our staff. We really appreciate it. I'm sure the students will have additional questions. I see Andrea has already sent out the hip hop session. So Jared, I see Jared respond to, we will make sure that you guys see that workshop, that PowerPoint presentation, I'm sorry. If you have any additional questions, please speak with your instructors or anyone on the team, and we definitely will reach out to Dr. Cunningham and her team to see if we can get some questions answered offline. Thank you all here today. Thank you for an amazing, I've now been to multiple of these workshops, and the questions that came out today were very, very great questions. So please, if you have not submitted attendance, click the link to add attendance. And if you don't have any other questions or any other objections, Dr. Cunningham, thank you for joining us today.
Thank you. I just wanted to thank everybody for their thoughtfulness, and they're really, taking the time to think through these issues and seek out, good information and spreading that among the community. It's so inspiring to see, and you guys are really thinking so carefully about these issues. It's wonderful. So it's an honor to be here.
Thank you. Have a
Thank you,
good
Dr.
day.
Cunningham.
Bye-bye.
May I ask something real quick? Dr. Cunningham, is there any way we can contact you, like an email or anything like that?
More than likely, you probably should reach out to us with any questions.
Yeah, I think that would be better, just because my email just tends to be a little bit like too much for me to handle. But if you send your questions to the folks, then they can pass it on to me. That'll be best, probably.
Okay, thank you.
Okay, thanks.
Thank you, Christian. Thank you, doctor.
Thank you.
So everybody, this was recorded, and this will be shared amongst staff as well as alumni and participants. Okay, so I guess that's it. Show's over.
All culinary students, just as a quick announcement, everybody in the culinary class, please log back on at 2:15. We'll give you a couple minutes break, take a stretch. Thank you all for being here. 2:15, log back onto our culinary regular link. Thank you.
Okay, we have a hand raised. You can speak. Unmute yourself.
It says N. N, you want to say something?
Can't hear you.
The question was, so I guess if I'll just email.
It's Nick. It's Nick. You can shoot it to me in a text or email, Nick. We'll get to it.
Thank you.
Okay. Thank you. Thank you, Ann. Okay.
Okay. All right, thanks, guys.
Hi, I have a quick question.
We're
If we're
done.
not registered with the school or culinary school, how can we get a recording of it? We are like related to Megan and want to have the information to share with other friends. Like, they were great questions you all asked, so we just kind of were interested in having those answers to share with other people in our community. Is it possible to get a link too?
Okay, this like I said, this is going to be shared amongst the students. So,
okay.
Yeah, it's going to be saved and shared. Just got to get off my computer right now.
Okay.
Yeah.
Sounds good. Thank you.
Okay. So that is it. Staff, are we staying on for any other festivities? Is that it for the day?
Nope, I think that's all.
All right.
Okay.
Good job, Mr. Bailey. That was excellent.
No problem.
Amazing, Mr. Bailey.
Goodbye, guys.
No problem.